mutant wave looms. After deadly second wave, Omicron cases rise across India. How prepared are we? Should you be worried? We're prepping you 100%. Unmissable Omicron insight and info. Brace for Omicron.
All right, Omicron cases continue to spike in India with 2 fresh cases in Maharashtra. The country's tally on the whole now stands at 23. A 37-year-old man and his 36-year-old friend who returned from South Africa and the United States respectively have been tested positive for Omicron variant on Monday. Both patients are asymptomatic and are presently admitted at the Seven Hills Hospital in Mumbai. 5 high-risk and 315 low-risk contacts of both these patients have been traced. Further tracing is currently underway. The country now reported its first 2 cases in Karnataka, which then followed by Gujarat. On Sunday, 9 cases of Omicron was detected in Jaipur. Delhi Chief Minister Arvind Kejriwal, meanwhile, has asked people not to panic and adhere to COVID protocols. Meanwhile, WHO technical group on immunization called SAGE will be holding a key meet today to lash out. In fact, they will be dictating those rules, protocols, recommendations for booster doses amidst the Omicron surge.
There is continuous rise in Omicron variant of COVID-19 cases in the state of Maharashtra. First 2 cases of Mumbai were reported yesterday, which brings total number of Omicron variant COVID-19 cases in the state of Maharashtra to 10. A 37-year-old man had travelled from South Africa, Johannesburg to Mumbai. He was tested positive for COVID-19. His another friend who travelled from USA was also found positive for COVID-19. Now, both of them had taken Pfizer dose of COVID-19 vaccine. They have no symptoms, but they are right now admitted to the Seven Hills Hospital in Mumbai.
Now, let's take a quick look at what are those Omicron symptoms. Omicron symptoms include a few of those that, of course, involves an itchy throat, tiredness, etc. Now, if you do speak of the symptoms being different from the other variants so far, we definitely say yes. But what are those? I would reiterate: tiredness, an itchy throat, mild muscle ache and dry cough. This is so far the symptoms that we know of as per the variant has been detected in various other countries. Generally, these are the symptoms that's suspected. Now, in fact, the question here is, do you need to worry about hospital and bed availability? Because that's what happened when the second wave hit. People were hustling for a bed, but it appears that the government has assured that they're ramping up all efforts in case of an emergency. Does illness involve emergency oxygen need? Will you be literally desperate for oxygen if at all this situation gets worse? Well, so far, as per the symptoms world over, the Omicron cases so far has not needed oxygen support. So it's not as fatal as expected. In fact, as what people believe and what they've detected on ground, it appears that this variant seems to be rather spreading fast, but on the contrary, less fatal. Now, could Omicron grow into the second wave like disaster? Of course, the possibility in numbers is likely, but in terms of fatality, like I did mention, is unlikely. Now, we're obviously looking at the Omicron cases growing in numbers. So far, 23 cases that have been reported in India alone, but none of these cases have been fatal, and that's what gives us some kind of respite. We're just hoping it doesn't turn out to be like the second wave. But I'd like to introduce our panelists here. Dr. Sandeep Budiraja, who's joining us. We also have Dr. Muzaffar Lakdawala, who's joining us. Piyush Goyal as well, who will be joining us. And I'd like to cut across to Dr. Mufazzal Lakdawala. Doctor, if you can take us through the severity of Omicron, as much as it's discussed in the country, 23 cases, it's already leaving us slightly jittery. We're looking at the infection spreading fast, but on the contrary, it appears that fatalities have been rare over the world. Should we be scared?
Good afternoon. And what we've seen is right from the epicenter of the Omicron, that is Gauteng and South Africa, where the majority of the cases have happened, is that its infectivity is far higher than its fatality. And that's a good sign in a way. Why the world has suddenly got alarmed and why WHO has declared it as a variant of concern is only because of its number of mutations on the spike protein, which is more than 32, which causes it to probably skip the current vaccinations that we do have. And that's why more individuals, like one of your anchors just said, that 2 people who had been vaccinated by Pfizer have got infected. Luckily for us, the mortality or the severity of this disease is far lower than what had happened in Delta. What had engulfed India during the second wave was the Delta variant. The rapid rise, which might happen with the Omicron as it spreads around, but the fatality. Omicron, Delta really took us by storm, and the hospitals were overwhelmed because the amount of oxygen that was required. But I don't think that might happen so far with Omicron. But it's very early days. We'll need another couple of weeks to really find out the fatality or severity of the Omicron, because we do know that the severity usually comes in the second week and the third week of the COVID vaccine, of the coronavirus.
Right. Dr. Piyush, over to you. As much as several countries across the world are placing restrictions, based on the threat that Omicron poses, should we really be worried? We heard what Dr. Laktawala had to say, but your perspective on the severity of this variant and what are the precautions that one must take?
Definitely. Actually, this is a new variant. We have a preliminary information about this variant, and the initial results of this variant, initial conclusions of the disease it's very encouraging right now. Actually, the thing is, right now it seems to be a very milder form of infection, but it is communicable right now, very much contagious, more than that of Delta variant, in view of the mutations and spike proteins which we have. So my point of view is that I think we should take we should follow a COVID appropriate behavior right now, and should take appropriate precautions so that we will not get affected in this wave. And my previous previous doctors told us that most probably the severity we still doubt, because these are the initial conclusions. We will came to know it after at least 2 to 3 weeks of this wave. Let's see how the people respond to this infection. Right now, as the anchor told, that there is no need of oxygen in South Africa now.
Well, so far cases have shown that there isn't a need for oxygen support. The number of cases that have been reported world over, none of them have been fatal. But Dr. Mufazzal, if I could ask you if children are more susceptible, because there was a lot of talk about how the third wave would possibly target children a lot more, because adults mostly have already been infected. So the next target of the virus would be kids per se. Do you see that with the Omicron variant affecting children more than adults? Any word on that? Any study on that?
See, we do know that kids, at least in India, are not vaccinated as yet. We do know also that the kids who have been vaccinated, there's around 10% or 15% vaccination in the US, which has happened. But in the epicenter of the Omicron in the US, majority of the people infected with the Omicron have been kids, and they've been toddlers under 2 years of age. So there is a bit of concern out over there. The severity, luckily, has been low for most of the kids who've been admitted. But the fact is that more than the Delta variant, yes, the Omicron is probably infecting more kids from whatever statistics we have right now available with us.
All right, so that's a lot scarier, because many countries have already rolled out vaccines for children. India is yet to do so. Dr. Sandeep Bodhiraja, Group Medical Director of Max Healthcare, also joining us for more on that. Dr. Sandeep, here we believe the Omicron variant has now jumped to 23 in numbers in the country, in India. And we're a little worried because the infection rate seems to be doubling, but the fatality so far is not as bad, not much for us to worry, is what health experts say. But do you reckon with that? Do you believe that there is something for us to keep in check? Of course, protocols must be followed, but that apart, anything that one should be worried of?
No, I think worry is probably not the right thing, but as a country, as a nation, we need to be prepared to handle potentially increasing numbers. As we all know, the information so far in the world is that it's more infectious than even Delta, but probably not as severe. So I think the numbers will be large. Now, the good news is that India, 50% of the adult eligible population is vaccinated, but that leaves yet a lot of population which is under-vaccinated or unvaccinated. And I think for it, what is clearly emerging is that irrespective, other than the conventional risk factors we know of, unvaccinated status is also a risk factor, and that's probably one of the reasons why we are seeing increasing numbers being reported in children, at least from South Africa, because that population remains unvaccinated. So I think the focus has to be multi-pronged. So we have to vaccinate people who are as yet not vaccinated, give the second dose, and at the same time cautiously open up the third dose for at-risk people, not to forget the COVID appropriate behavior, gear up with our manpower, infrastructure, and test, track, treat, and isolate and vaccinate. I think these remain the basic principles of management, and as a country we should just focus on these now.
All right, Dr. Mufazzal, a quick word on the typical symptoms that you've seen of Omicron.
Most of them have been either mildly or almost asymptomatic, and most of them have been picked up on routine testing, and that's a real relief. But the ones who do have symptoms, of course, have mild fever, sore throat, quite unlike the Delta, which had a lot of GI symptoms. So this is classically only upper respiratory tract infections with the Omicron variant that we are seeing.
All right. Dr. Piyush, as per your record, how have people come to your clinic complaining of trouble during this weather condition? In Delhi per se, where I'm sitting, it is very cold, and it was expected that winter season, it could really aggravate the COVID symptoms as such. Did you see particularly people coming in with any issues with their health due to this weather, almost aggravating COVID-like symptoms? Dr. Piyush? All right, let me cut across to Dr. Sandeep. Dr. Sandeep, if you can hear me, the winter weather was said to be the worst for COVID-19, and it appears now as we are in the thick of winter. Do you believe that this weather is not the most compatible for people with comorbidities, considering, or those with respiratory issues, and the Omicron now in the air, we're a little worried?
Absolutely. So it's a double whammy situation for people, at least in north part of the country, where because of extreme cold conditions and extremely poor AQI, I think both are adding on to the woes of people with respiratory diseases, elderly people with comorbidities. We are seeing increasing number of patients coming with respiratory illnesses, their exacerbations of asthma and bronchitis, chest infections, non-COVID respiratory viruses like flu illnesses, all have increased. And now over and above that, this Omicron strain definitely would compound to the existing number of patients reporting with respiratory illnesses, especially children and elderly. So I think that's where the focus and emphasis in the last 2-3 months, we have really focused, other than COVID vaccinations, on the seasonal flu vaccine. And a lot of my patients who have been inquiring about whether there's any need for taking flu vaccine, we have actually been absolutely, insisting on that people to take their seasonal flu vaccine and the periodic pneumonia vaccine as and when. So because whatever best protection can be offered for these other respiratory illnesses, one must do that. But yes, I think these are next 4 to 6 weeks or 8 weeks maybe for northern belt of the country is going to be a difficult period.
All right. Dr. Mufazzal, are you in favor of a lockdown? Because there's a lot of talk, many states that have detected the Omicron cases, like for example, Karnataka, were in panic mode. As soon as those cases were detected, the government was already mulling over a lockdown or not. Are you in favor of one? If not, what else is the best option?
I think right now we are done with the lockdown phase of the variant. We've almost spent close to 2.5 to 3 years with this pandemic, and I think most people are exhausted. There's a lot of COVID-related fatigue. So lockdowns will not work. It won't work even if the government wants to impose it. But what the government can do, and what they're doing currently, rightly, I believe, is to really chase all the people who are coming in from abroad. Remember that more than 45 to 50 countries have now been infected. So let's not blame only those arriving from those 6 nations which the ICMR has so far listed or the government has so far listed. Remember that it could come from anywhere. So let's target all those people who are coming from abroad, test them, treat them, and track their close contacts to prevent the Omicron really breaching its way into India. We've got only 20-odd cases so far detected. Let's keep it very, very low. So I think only really chasing those people coming into the country will be able to prevent it. Any more lockdowns will not really help.
All right. Do stay with us, doctors. I'd like to quickly cut across to Managing Director of Medanta as well, Dr. Naresh Trehan, who also spoke about the concerns that's been raging over the new Omicron variant. Let's take a listen.
Do existing vaccines that we have taken already, will they work against Omicron or not? For example, I'm double vaccinated. I want to know that I may have antibodies already. I have contracted COVID-19 twice in my case. But will none of this stand up, sir, to keep me safe against Omicron?
So, this is not very clear. That is what immunity does to you. What the antibodies do to you is to say that the virus can come inside your body, but you have the ability to fight it to limit the extent of the infection. That's the immunity you acquire if you have had COVID once or twice or had your 2 shots. So the fact is that despite the fact that you have been double vaccinated, there is a smaller chance, but there is a chance that one can get infected. If that happens, it's milder, of course. And if it happens without the antibodies, like people who have not been vaccinated, then it is much more severe because the virus can freely multiply inside your body. If you have immunity, the immunity or the antibodies will actually limit the virus from multiplying, and eventually you'll get better. So that's the difference.
All right, we heard that. Let me cut across to Dr. Piyush Goyal. Dr. Piyush, we know that Omicron has been found in many countries and there seems to be a sense of panic. But thankfully, large parts of the population across the globe have already been vaccinated. Yes. Do you think the vaccine is the key reason for the Omicron variant not being fatal?
Yes, definitely. Basically, if you see in this variant, there are multiple mutations, and most of the mutations are there on a spike protein, right? And the vaccine which are there in US, in UK, and also in India, we have a vaccines which the essence, the mRNA remains the same for that Omicron variant also, most probably. So that is why these vaccines are more effective, will remain more effective in this scenario also. So we no doubt about that, we can get some infections, but the severity will be absolutely, I think I'm very sure that it will remain very less in vaccinated people.
All right. Dr. Mufazzal, there's a lot of talk again about a booster dose, a booster shot. World over, this is being discussed. Do you believe that it's time for India to consider a booster dose as well? Or is it still at a stage where we're still working on the first 2 doses and that's working quite well on our body? We don't yet need a booster dose. What, in your opinion, should we do?
I think we have now documented evidence to say that the vaccine-induced antibodies do wane over a period of around 3 to 6 months. So yes, there is some method in madness if people who are suggesting that you take booster doses. But yes, it is meant only for those who are frontline workers who are going to be exposed very readily, for those who are immunocompromised and are at a much higher risk. For those people, I would recommend that it would not be incorrect to suggest a booster dose. Again, remember that there are 2 forms of immunity, the T cell and the cell-mediated immunity. So when there could be a case here to probably mix the vaccines and probably try combinations so that there could be more usefulness and you could develop both forms of immunity, and that could eventually give you more long-lasting protection. But that has yet to be proven medically, of course.
All right. Dr. Sandeep Budiraja, I'm going to close with you, and please do leave us with some hope and positivity. We're hoping that the Omicron does not cause panic, and to that effect, what would be the guidelines should people follow going forward?
I think the guidelines remain absolutely same. Whatever name of mutant comes in, the basic protection is offered by face mask, using a face mask which is rightly fitting and rightly put, not hanging down, maintaining social distancing, avoid crowded places as much as you can. Even if there has to be a meeting or people getting together, please do it in more open spaces, have a good ventilated room. I think these will remain the core principles of preventing the transmission of a virus, no matter how infectious that might be. Vaccination, people need to understand and get out of their vaccine hesitancy. So please, for those who have not taken their first and second doses, please do that. I think government is considering third doses for limited category of people. Let's wait for that decision to come in. And I fully agree with the previous panelists, what they have spoken. I don't think lockdown, a national lockdown, any role. I don't think blanket banning of flights would have much role. The basic remains track, trace, isolate, treat, and vaccinate.
Excellent. Thank you very much, Dr. Sandeep, Dr. Piyush, Dr. Mufazzal. Appreciate you joining us on this broadcast. For that, it's a wrap on this bulletin. More on this, you could log on to indiatoday.in. You could also download our app for more. But stay tuned. News and updates coming up on the other side.